Welcome to Tell the World Project, Becoming an Emergency Room Nurse. My name is Kimberly Snyder. What is a nurse? Nurses comprise the largest segment of the healthcare workforce, with the most notable influence on the healthcare environment. Many growth opportunities within the areas of nursing exist, from registered nurses to LPNs, nurse practitioners to CRNAs. Why become a nurse? Nurses work with a diverse population. It's a lifelong profession that allows for growth and the ability to change in any different direction within the field. They make a difference in other people's lives, utilizing communication and professional skills that are not only acquired but are utilized daily. They improve people's lives through education and devotion to their patient population. It's a very respected field and profession, with much stability in the workforce, as the needs and demands of nurses is ever increasing. They provide adequate incomes for their families with educational opportunities, many scholarships, many different areas of nursing, and the ability to either get their BSN or to go through ADN programs that allow them to go to school while they're also working. Most importantly, you're an advocate for many. Tell the world. What is an ER nurse? An emergency room nurse is your frontline healthcare worker. He or she is the first one you often see in your worst moments. Since the pandemic changed the world of healthcare, emergency nurses have stepped up even more to address crowded hospitals and the influx of critical care patients. For COVID patients, the emergency room is often the first stop before being admitted or for additional treatment. As an emergency nurse, every day brings challenges because every day is filled with a variety of emergencies, including the waves of COVID-19 patients. Nurses must expect the unexpected and have the ability to stay calm in the midst of a crisis, working with a diverse population. They work a wide array of tasks, ranging from triage, trauma, minor injuries, and minor emergencies, meeting incoming patients, performing assessments, determining next steps in care, cleaning rooms for new patients, regulating flow of the department, and mass casualties. Patient and physician communication is also important. ER nurses are an integral part of the healthcare team and can be the first point of contact for patients. They must be able to gather information that may be needed for diagnosis, and they will likely need to relay the information to the rest of the healthcare team, including physicians. In addition, nurses may ask to relay information to the patient's family. As a result, nurses must be good communicators, as I've stated before, since they'll be talking to a lot of people throughout their shift. They need to know how to ask questions effectively and how to listen to answers, as well as watch for clues on what a patient may not say. There's minimal downtime. The pace of the emergency room can vary, and there may be downtime after patients are moved from ER rooms to other parts of the hospital or sent home, but usually it's not very long. When it's quiet, nurses help restock supplies or prepare the unit for the next patients. They also review reports, paperwork on the patients who were admitted or discharged. Since COVID-19, though, downtime has been minimal for many nurses. The shift lengths are very long. In many facilities, nurses do work 12-hour shifts. In the ER, however, there's no guarantee that you will leave after 12 hours. As is in the case with emergencies, you may not be able to exit from a situation just because your shift is over. But since the ER is a fast-paced environment, the shift can fly by, especially if the hospital has high inflow of patient needing care. You must be able to respond and equip any emergency quickly by assessing the patients. You can also be cleaning wounds, drawing labs, providing life-saving measures, performing tracheostomies, intubations, CPR, bone setting or splinting, sutures, administering blood products, and many more. What does it take to be an ER nurse? In the ER, time does move quickly, and there's not a lot of time to adjust. 1 minute you may be working with a critically declining patient who has been in a car accident, and the next you can see a patient with a common cold. Every day in the ER is different, and the ER nurses must be able to adapt and respond to new situations at a moment's notice. Although working in the ER might be too fast-paced for some nurses, I've found it to be incredibly rewarding in the field. As an ER nurse, I've learned valuable leadership, communication, and critical thinking skills, while also expanding my knowledge in the nursing field, as well as a wide variety of different specialties. I've worked with EMTs, first responders, and many different points of care, quickly responding with patients to initial assessments and working with a team of doctors and nurses to ensure that proper care is administered to my patients. Using that strong critical thinking, being confident in the knowledge and training, able to use good judgment when needed, and work quickly and efficiently. There's a variety of settings, illnesses and injuries, and varying complexities within all age ranges. Urgent situation requires excellent critical thinking. I've included a daily timeline. Allow me to walk you through it. 5:30 in the morning, I'm up in the shower, getting ready to work with coffee in my hand. Soon after, I'm clocking into work, getting my phone and radio, meeting with other staff in the rainbow room, as we call it, for daily assignments and important information for the day. To receive my report from the night nurse and the status of my patients. I quickly go into each room, usually it's 4, one being a trauma, and quickly assess vitals and introductions, filling all linens, nurse servers where we keep our supplies, gloves, trash, anything that needs to be taken out or cleaned. By 8 a.m., I'm now running into room to room, ordering, getting labs that might be missing, any calling reports that might be needed on many patients that sometimes wind up holding in our department. But I need to arrange transport to get patients who are missing x-rays or need extra labs. I've ordered breakfast for most of my patients that are on hold. By now it's 9 o'clock. I have new patients in the rooms. Some have left. Oh, there's a code neuro. Time to grab my quick EKG, get labs quickly, do an NIH stroke scale to CT and quick imaging. Patient needs TPA, so we quickly administer back to the room and arrange flight for another facility. Now, while I'm doing my every 15-minute assessments on the stroke patient, I may have a squad coming into the next room. They're a dementia patient. They're having trouble breathing. Quick report to the monitor. Line, labs, put on a nebulizer. They keep taking it off, back to the neuro patient. 10 a.m., neuro patients leaving by flight need to provide report, get them out the ER to a higher acuity center. Overhead level 1 trauma and trauma 5, ETA 10 minutes. I have 10 minutes. I've checked on my other patients, given migraine cocktails to a patient, and clean neuro room. Looks like a triage patient is coming for abdominal pain. On the monitor, look down the hall, there's the trauma. 11 a.m., I finished my trauma. The patient's on propofol drip and intubated, awaiting call report on ICU, back to abdominal pain, and a report for earlier patient to go to the cardiac floor. 11:30 a.m., my abdominal pain workup is complete with IV labs, x-rays, fluids, and medications. New patients in 2 rooms. One's left to go to cardiac floor. The other has been sent to transport to go to med-surg for another evaluation on respiratory distress. ICU is called, transported patient, provided bedside report to ICU nurse. By 12 o'clock, I've checked in 2 new patients, one with COVID symptoms and 1 drug overdose, called poison control and put in psych evaluation, line and labs completed, and still haven't gone to restroom or finished my coffee. 12:30 to 1:30, I've discharged the COVID symptoms, arranged for sitter on drug overdose, and spoken with the family regarding the need of drug overdose. New patients are coming from squads. Level 3 trauma, 80-year-old female. She's fallen on blood thinners. Time to check in squad, line labs, get to CT ASAP for bleeding assessment. 1:30, my day's almost over. At least it feels like it. Level 1 trauma called, gunshot. Lockdown to the department, line, labs, blood administered, called OR. Transport a patient myself to OR for staff. 1:50 p.m., level 3 fall has been called to arrange transport back to home due to altered mental baseline status. 2 o'clock p.m., CPR in progress, on its way, but first needed to check on the 6-year-old that fell from the monkey bars and needs splint and a referral to an orthopedic doctor. CPR's here. Time for compressions, epi, etc. Patient doesn't make it. No ROSC. Time to call for transport, possibly, and call family. 3 p.m., provided report to new nurse, taking rooms, moved to triage for the last 4 hours. Waiting room is full. There are 10 waiting for triage and 6 need EKG protocol for admission. EKGs are done, 10 are assigned acuities, no rooms. Off to the room for quick line and labs to ensure none have any life-threatening labs that require quick needs, or appendicitis, or abnormal EKGs needing rooms. From 3 to 7, I've checked in and quickly triaged 65 people. I've organized the flow of the rooms and put the patients in room per the acuity level, read labs on patients waiting, and worked with front of the hospital doctors on addressing needs of those waiting to be seen. Our hospital has 177 patients we've seen today. I've not had lunch, and I've only gone to the bathroom 2 times. I've never finished my coffee, and I was able to get a cup of water around 2 o'clock. I'm beat. My legs hurt. My feet are burning. And there are 10 more checking in to be seen. I give a report to the next triage nurse, and I go get my belongings. By 8:30, I'm home. I've showered, checked my email, made dinner for my kids, and worked with homework. By 10 o'clock, I'm going to bed, setting my alarm. Time to do it all again tomorrow. Why I chose to be an ER nurse. We take care of patients of all ages with all different disease states. No day is the same, and you always are ready to shift up. I learn something new every work shift and always feel that I have the opportunity to develop and grow in my profession. I make a difference in lives every day and every shift, where nothing is ever the same. I'm always challenging myself to learn new things and to grow in my profession. It's exciting, it's fast-paced, and I can positively impact and help in the community with patients and families, not only in their healthcare during their greatest time of need, but also in the education on how to alleviate or prevent diseases. A little bit of what nursing means to other people. They love it for many reasons, all of which you can read here, from educating patients to taking care of themselves to the trust they build in their eyes. Every learned day there's a new opportunity for growth. Every day there's a new opportunity to be the advocate and to help someone else. My purpose. Telling the world what I do is the easy part. The hard part is relaying the feelings in which I carry with me. There is such thing as burnout in nursing. It is crucial that by me telling the world about nursing, that the information is received to the public so that you're aware of the demands that nursing has on one's life. We selfishly give of ourselves, our time with our families, for you and your family. We do this because we want to be there for you. Please show grace to the nurse that is trying to help you. To my fellow nurses, I stand beside you. I will continue to admire your bravery and endurance through all the dedicated hours you give to others. There aren't enough words to express the gratitude that I have for you, and working beside you is a pleasure and an honor. It is true that we go to war many days, battling things we can't see and that we sometimes don't know. But I wouldn't go to war with anybody else other than a nurse. My purpose? To dispense comfort, compassion, and caring, even if there's no prescription for it, and even if it is not just my patients, but my coworkers as well. In summary, I'm not just an ER nurse. I'm also an L&D, an orthopedic, a respiratory, surgical, neuroscience, pediatric, oncologist, etc. I get to help every patient population and most every disease process. I'm not just an ER nurse. I'm a proud registered nurse, and I wouldn't change that for anything. Thank you.